If you have a strong family history of dementia, does that mean that it's inevitable for you? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and this came up during a recent interaction with one of my patients where they were like, well, my mom has a dementia, my grandmother had dementia, and I know I'm probably going to get it too. And of course, that sparked a conversation that I think is worth talking about here as well. So there certainly are things that increase your genetic disposition to developing dementia. Things like the known ApoE allele. However, there are also a lot of different lifestyle factors that are going to come into play when it comes to the development of dementia. I'm going to talk about 3 of them here. The first one is going to be that of insulin resistance. So we've come to learn that there is a very close correlation between insulin resistance, diabetes, and other sugar issues and the development of dementia. People who have insulin resistance and diabetes are much more likely to develop dementia. So much so that researchers at Brown University coined the term type 3 diabetes to describe dementia. And there are probably multiple different causes to this. One, when you are insulin resistant, your brain cells are not able to properly utilize food for fuel, which leads to dysregulation of that cellular metabolism and poor functioning. And associated with that is going to be things like inflammation and oxidative stress, which are all going to contribute to neuronal cell death and malfunctioning. So one thing that you can target is your insulin levels. Things that decrease your insulin levels are going to be eating plenty of fat, protein, and fiber with your meals, decreasing your intake of refined sugars and carbohydrates, limiting the number of times you eat per day, as well as in some cases, carbohydrate restriction. Okay, let's talk about the second thing you can do to reduce your risk of dementia. The second one is going to be exercise. We have numerous studies showing that those who engage in regular exercise, whether it's strength bearing, cardio, or a combination of both, have a much lower risk of developing dementia. And this is probably correlated to the insulin resistance issue because we know that those who exercise are better able to handle glucose loads that are coming in through meals and have a lower risk of insulin resistance. And then lastly is keeping your mind active, engaging in mentally stimulating activities, things like puzzles, board games, reading, as well as engaging in regular social contact with others are all going to be crucial to maintaining good brain health. Sitting around all day watching TV is not stimulating and is not going to help you maintain your brain function. So these are 3 practical things you can do to reduce your chances of developing dementia. This list is not exhaustive. I'm sure there are others as well. If there's anything that you found helpful as far as maintaining your brain health and memory, then please share it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.